that's it. I'm gonna let Charles get started, and I am taping. Go.
Okay,
You don't have to look at the camera.
I know. Good morning, everyone. My name is Charles Clarkson, and I am the project director of a federally funded program called the Senior Medicare Patrol, and that's what SNP stands for. Every state has a Senior Medicare Patrol, and you probably never heard of us. And technically, we're funded to help fight Medicare fraud, waste, and abuse. But I am also a SHIP counselor, which is the State Health Insurance Assistance Program. And that program is also federally funded, and their job is to help people with enrollment issues and stuff like that. And that's what we're going to talk about today mostly. There is obviously a lot of fraud in Medicare, and believe it or not, if I told you the amount, you wouldn't believe it. It's 60 to 80 billion a year. And you are all paying for it because it comes out of our tax dollars. So we go through around the state and we basically give presentations to educate people about Medicare and Medicare fraud. And we also help investigate Medicare fraud as part of our program. We get complaints from beneficiaries. We try to resolve those complaints. If we can't resolve those complaints, then we'll send it to the Office of the Inspector General, who would take over for us. So that's basically our program. You want to stop this for? Okay.
Oh, thank you very much. Sorry to be late.
Okay, so let's talk about Medicare in general. Remember, when you first are becoming eligible for Medicare, it usually happens when you turn 65. And of course, if you have a disability or you're handicapped, and you meet the disability requirements for Social Security, technically you can be of any age. Okay? But let's just presume that's not an issue, and we're all here based upon our age, which is 65. So basically you have two choices. One is original Medicare, and the second is the Medicare Advantage plans. And I gave you all a chart on the next year's Medicare Advantage plans for 2026. Okay? So I'll use myself as an example. I'm on Medicare, and I decided to stay with original Medicare. So then I have a supplement plan as my secondary, and then I have a Part D drug plan to cover my drugs. Now my other choice would have been to enroll in a Medicare Advantage plan, which people call an all-in-one plan, because you don't need a supplement and you don't need a drug plan, because all of these plans, in most cases, unless you're selling it or you're a veteran, or because then you can get veteran drug coverage. You don't need to pick an Advantage plan with drug coverage. But in most cases, 90% or maybe higher, all have drug coverage. So if you're on original Medicare, you get a separate Medicare Advantage card, and that's what you use to basically get your services. Okay? So, how do you choose? Well, I'll give you my personal opinion. Remember, during open enrollment, which is, every year there's a period of time where people are allowed to make changes. And we are currently in the open enrollment period, which started October 15th and goes through December 7th. So if you're already in Medicare, you're allowed to make changes. For instance, you can go from original Medicare, because maybe it's getting too expensive for your supplement plan, and decide to enroll in a Medicare Advantage plan. If you're in a Medicare Advantage plan, you can switch to another Medicare Advantage plan. Or if you're in a Medicare Advantage plan, you can go back to original Medicare pick up a supplement, and also buy a drug plan. But I'm gonna tell you some of the issues when you do that. People don't realize that if you're in a Medicare Advantage plan for more than 1 year, and you try to go back to original Medicare, you may not be able to pick up a supplement plan because you no longer have a guaranteed right to purchase it. The rule of Medicare is this: once I have A, but I need B. Once I have Part B, which is your doctor and other lab coverage, I have 6 months to enroll in a supplement, and they will not turn me, or they cannot turn me down for any reason. If I'm in a Medicare Advantage plan for less than 1 year, I'm allowed to go back to original Medicare and have a guaranteed right to pick up a supplement. And the supplements are also known, by the way, as Medigap plans, because they fill in the gaps that Medicare, original Medicare, doesn't pay for. So during this time period, you're gonna see a lot of commercials on television offering Medicare Advantage plans because of all the other benefits they offer. Remember, if you're in a Medicare Advantage plan, you might get hearing, some kind of hearing, prescription, or dental. They're not true insurance, but they might give you a certain amount of money towards the purchase, let's say, of hearing aids and things like that. So that's the real benefit from being in a Medicare Advantage plan. Also, what they're doing now is they're offering gift cards to people enrolling in Medicare Advantage plans. For instance, you might get $100 a quarter on a gift card that you could spend either on healthy items, but now they even allow you to spend it on anything, utilities, groceries. So in early on days, they wanted you to buy something healthy, but that's no longer the case in many, but every plan is different, so you have to check with the plan. So that's causing more and more people to enroll in Medicare Advantage plan. When I first enrolled in Medicare Advantage, 35% of people had Medicare Advantage plans, and most people were on original Medicare. Over the years, because of these extra benefits and the advertising, more and more people are enrolling in Medicare Advantage plan, and now it's almost 50-50. And by the way, there are about 65 million people on Medicare, just to give you an idea how large the program is. And of course, we all pay for Medicare while we're working with the Medicare withholdings. And of course, you also pay for Social Security withholdings. So we do that over the years, and then when we turn 65, we can enroll in Medicare. But let's talk about a situation where you don't want to enroll in Medicare. Let's say I'm still working, and I'm covered from my job. Now, if I'm working more than 10 years, I have 40 credits because I've earned a certain amount of money, I can enroll in Part A for free. So we always recommend to people, even if they're still working and they don't need additional coverage, enroll in Medicare, get your card, and only get Part A. You could turn down Part B because you don't need it because your job is your primary coverage. The rule is this: if you have 20 or more employees at your employer, then the employer plan is primary. Okay? So you could, that can be your primary coverage. You don't need Medicare. Why would you pick up Part B, which costs money and has deductibles? And why would you pick a drug plan, which costs money and has deductibles, if all that is covered from your job? All right? Now, you always have a right to, let's say your job coverage is getting too expensive, or it's not a good plan. I mean, when I had a choice, I worked with Jewish Family Services of Middlesex County. They have health coverage. Because I looked at it and I said, this is a terrible plan. So I dropped it completely and went on Medicare. Even though it's a lot more expensive, I wanted to have better coverage. Now, right now, the Part B premium is $185, and you have to expect that that's going to go up every year. The deductible goes up every year, okay?
That's per month?
The deductible
No, the $185 is per month.
is the premium for Part B,
Per month.
per month.
Per month, yeah.
Everything I'm talking about is
Okay.
per month unless I say otherwise,
Okay.
okay? So I'm on a supplement plan. I have the F plan run by AARP United Healthcare. If you're new to Medicare, you cannot buy the F or the C plan. They are no longer sold. Why? Because the F and the C plan covered the Part B deductible. And Congress said too many people are going to the doctor because these plans are paying the deductible, which made no sense to me because I don't go to the doctor unless I have to. You know, but that's what their thinking is. So the F and the C plan were dropped. If you already had the F with the C plan, you can keep it as long as you keep paying your premium. And you have to expect, if you're on original Medicare and have a supplement plan, that premium is going to go up every year as you age. So again, using myself as an example, I'm in the AARP F plan, and that plan is costing me $359 a month. My wife is on the same F plan, and she's also paying $359 a month. We also have 2 Part D drug plans. Now they're not too expensive. I'm on the Cigna plan, which costs $9.90 a month. And my wife happens to be on the same plan because both of us don't take a lot of drugs, and they happen to be the cheapest plan when we did a comparison and decided what plans to enroll in. So every year, I always tell everybody, compare your plans and make sure you're in the best plan for 2026. Remember, you don't have to change anything. I'll give you an example. My Cigna plan right now is $9.90. It's no longer being offered next year, and it was sold to Health Spring. Well, that same plan is now next year $59.90. It's gone up $50 a month. So I did a comparison for myself, and the drug plan that's coming up is the Humana basic drug plan, which only costs $4.40. So I enrolled myself in that, and when I did a search for my wife, that plan also came up as the cheapest, so I enrolled her in that plan. Now, as a SHIP counselor, which is the program for assistance for Medicare, I get very busy this time in the year advising people what changes they should make. Because just because you're in a Medicare Advantage plan, let's say, and it's working for you, these plans change every year. How do you know the plan you're in is going to cover all your doctors next year? Is it going to cover all your drugs next year? And only 5% of people even compare plans. So if I didn't compare plans in my Cigna plan next year, I'm stuck on January 1st. I'm going to start paying $59.90, and I cannot change until the next year, 2027, which is why you have to compare plans. And it's hard to compare plans, I know, because Medicare has a website, which is medicare.gov. And if you click on Find Health and Drug Plans, just scroll down, you'll see a little blue bar, Find Health and Drug Plans. You can then compare Part D drug plans. You can compare Medicare Advantage plans. And there's some information about Medicare Supplement, i.e. Medigap plans. Okay? So, they don't say this on the television commercials. But what are the downsides for a Medicare Advantage plan? Well, first, the biggest one is a network. All these plans have networks, so you have to make sure your doctor and the hospital you're going to go to are in the plan. Don't presume that they are. You should call up all your doctors and say, doctor, what plans do you accept? Are you going to accept this plan, the current plan I'm on? If not, it's probably better for you to switch plans. Also, more and more of these plans are now using prior authorization to deny coverage. How can these plans give out so many additional benefits? Well, because you don't realize that the plans are paid every month a stipend to give you health insurance. And that stipend is anywhere from $900 to $1,000. If you have chronic conditions and you're in a Medicare Advantage plan, the government pays those plans even more money. So how do you make money as a Medicare Advantage, which are very profitable, by the way? You deny coverage. So not only the network, prior authorization, but sometimes they'll say, we don't think that's medically necessary. We're not gonna cover it.
I have two questions.
Yeah,
One is around mental wellness and whether Medicare covers mental wellness. And then the second is for the Medigap. My understanding is they only pay the difference if Medicare reimburses it. So for example, if Medicare says, no, we don't cover mental wellness, you can't use that gap plan.
that's correct.
Okay.
That's correct. The Medigap is a secondary coverage.
Yeah,
So if the Medicare, the primary coverage says no, you're not gonna get any help from your Medigap plan. But mental health is a coverage item under Medicare,
correct.
okay? So it should be no problem. You know, obviously there are a lot of things that original Medicare doesn't cover, you know, it doesn't cover dental, hearing, and vision. It doesn't cover Meals on Wheels. So all these additional benefits are in a Medicare Advantage plan, and more people. Let's say you didn't drive. Maybe you want to pick a Medicare Advantage plan that'll take you to the doctor because they have a certain number of one-way drives to and from your doctor. Because you need help going to your doctor. Well, that might be something that works for you. Now, here's my bias.
Question.
Yeah.
So on Medicare Original, no doctor can decline you? I mean, they all have to
Oh, no,
accept you
no,
and
yeah,
treat you, or
a
how-
doctor
or-
does not have to be in Medicare.
Okay.
But 95% of all doctors are enrolled in Medicare because the senior population is so large, it's hard to treat people who are not seniors and only have Medicare. So you'll find that that's not the issue. One of the advantages of being an original Medicare is Medicare Original, you can go to any state in the country and you're covered. Okay? As long as that doctor accepts Medicare. You don't need referrals. You can go to any doctor that accepts Medicare. Whereas in a Medicare Advantage plan, if you need to go see a specialist, you might have to get a referral from your primary doctor. If you drive to Florida because you like to be down there a couple of months a year in the winter, you're probably not covered under your Medicare Advantage plan unless it's an emergency. So you could see some of the issues with Medicare Advantage plan. Now here's my bias. If you can afford to be an original Medicare, buy a supplement, and buy a drug plan, that's where I would rather be. I don't want, when I had my choice, I didn't want Medicare Advantage to tell me what doctor I could go to. Okay? And I'm also an attorney. Well, I was an attorney, but I worked all my life as an attorney, so I have significant savings. So buying and staying in the supplement, no matter how high the premium goes, is not going to be an issue for me. But for some people, like my sister, I have a sister who lives in West Palm Beach in Florida. She really worked during her life, always relying on her husband. Then she got divorced, so she moved to Florida. Well, she only has Social Security. So I put her in a Medicare Advantage plan, 5-star in Florida, because she could not afford to buy the supplement and the drug plan separately. And there are a lot of people like that. So it's not that Medicare Advantage plans are bad, it's just that you have to know the differences and the downsides, but you never hear on television. Also, during open enrollment, people are swamped with mail from Medicare Advantage plans offering different plans and trying to get you to enroll because it's profitable. They make a lot of money on Medicare Advantage plans. And you know, they're the big company, I'll be right with you. You know, the Aetnas, the Humanas, the Blue Cross, Blue Shields, United Healthcare. All of these companies sell Medicare Advantage plans.
What kind of supplement were you referring to?
Well, if you have original Medicare, that's not enough. You need a secondary coverage. Because remember, Medicare only pays about 80%. So if you went into a hospital for a long, for a decent stay, that bill could be substantial and the doctor's visits may not all be fully covered, and that can cost you a lot of money. So most people on original Medicare have a supplement plan, which only works with original Medicare. You cannot have a Medicare Advantage plan and a supplement plan at the same time.
So the supplement is like from private, like Blue Cross?
Yeah, it's sold privately, but they're approved and they're sold by letter. So the supplement goes from letter A to letter N, and there are certain letters missing in the middle, but they no longer sell the C or the F plan. Now, I'm on the F plan, okay? And I know my premium is gonna go up, and it's probably gonna go up a lot faster than the current best plan, which is the G plan. Why? If they're no longer selling the F plan or the C plan, this group, i.e. me and my other people in the F plans, are getting older. And no new people are being allowed in. As you get older, you use more medical services, and they know that. So they're gonna keep raising the premium, because they don't wanna lose money on their F and C plans. So, and I figured, okay, this is gonna happen. So I called up AARP United Healthcare and I said to them, I'd like to switch to the G plan, which is the best plan out there and is still open. And they said, oh sure, Mr. Clarkson, we'll be happy to let you switch to the G plan, but we're gonna triple the premium. Now, why would I do that? That's crazy, So, people in the Medicare Advantage plans, when things happen and they realize, I really need to be back on original Medicare, but they're in the Advantage plan for more than a year. You could always switch back to original Medicare, but the supplement does not have to sell you a plan because of your chronic conditions. And people don't know that. So never switch back from your Medicare Advantage plan to original Medicare unless you're positive and you have evidence that you could enroll into a supplement. Because having A and B alone is not sufficient. And you also need a drug plan. Now the drug plans are no problems. You could always enroll in a drug plan, but the supplement is a real issue. Now in some states like New York, you could have a guaranteed right to buy a supplement plan anytime through the year. But that's not the case in New Jersey. In New Jersey, you only have that guaranteed right for the first 6 months after you have Part B, and after that goes away. So that's a difficult problem. Why they don't allow people to go in a Medicare Advantage, a Medicare supplement plan all the time, I don't know. But that's the rule. Okay? So, when you're working, you don't need to have Medicare. We recommend if you have the eligibility, you enroll in Part A because it's free, you work 10 years. Yes?
I have understood that if you're in a health savings account,
Yes.
and you apply for Part A Medicare, you can no longer...
That you can have both.
Okay.
Okay? You can keep it, but once you enroll in Medicare, you cannot add to the Medicare savings accounts. Okay? So those are the downsides of a Medicare Advantage plan, which you're never going to hear on television or in the mail. But just be aware of that. And if you need help comparing plans every year, for instance, the last 3 years, I have changed Part D drug plans. And I gave you a chart of the Part D drug plans available for 2026. You can see it's not that many.
This says it's page 2 of 4, so are there more?
I know, but there was nothing on 3 and 4.
Okay.
Trust me.
Okay.
And that's why you see W is at the end of the alphabet on the second page.
Oh, right.
Okay? So, as you can see from the Medicare Advantage plans, how many plans are being offered. Now, of course, these plans can be limited to certain counties. So, you have to make sure if you're going into Medicare Advantage plan, it's available in your area. And, usually you can find this Medicare Advantage plan with a 0 premium in your zip code. And I always tell people, Why would you roll in a Medicare Advantage plan with a premium when there's a zero premium plan and there's probably not many major differences?
I have a question. So you say when you are on Medicare Advantage, going back to Medicare Original, there's no guarantee in New Jersey that you
If
might
you're
get
in the Medicare Advantage plan over a year,
over a year exactly that you can go to the original and get a supplemental plan in New Jersey, but in New York that would be possible, right?
that would be
So
possible.
is New Jersey kind of more the rule nationwide, or is
Yes.
New Jersey kind of more the exception?
No, New Jersey is mostly the rule.
Okay.
And you can tell because when you look up supplement plans in New York, which I have done, the premiums are a lot higher because they don't turn anybody down.
Mm-hmm.
So any sick person can go on a Medicare supplement plan at any time.
Mm-hmm.
And so the
Got it.
premiums in order to make up for that are much higher in a state like New York, and there are a couple other states like that too. I don't
What would
remember
be
all
those
of
other
them.
states? I'd be curious to know. Do you know what the other states are?
No, I don't. I don't memorize that.
Okay.
I should, but I don't.
Okay.
Can you discuss, the different prices of, you know, regular Medicare based on what your 2-year look back of your salary was?
I'm sorry, I'm not sure I understand the
Is
question.
there a difference in like regular Medicare based on what your 2
No,
years of
there
salary?
are no income or any kind of asset tests for original Medicare, okay? Or Medicare in general,
But I
unless
thought
you
that-
make a lot of money.
I thought the Part B varies based on
Right,
your
doesn't
income.
it?
Yeah,
over the
if
3
you're,
years.
if you're
That's
an
what I'm asking.
individual or a joint couple filing tax returns, and your income is over a certain amount of money, which I think is pretty high, it's like 190 something thousand, then you're subject to IRMA.
Which is,
IRMA is income related Medicare adjustment amount. So you pay additional for Part B premium, and you pay additional amount for the Part D premium for your drug plan if you make a lot of money as an individual or as a couple. And it's based upon your tax return 2 years ago. So the 2024 tax return is gonna be the basis, I have to admit, my IRMA for 2026. Okay, I don't know what the amount is yet, but I know I'm gonna be subject to it based upon my 2024 tax return. So that's the only income exception on Medicare, and that means 99% of people don't have to worry about paying more than the actual standard amount for Medicare Part B, the deductible, and Part D, the premium based upon the plan you pick.
but if you're single, what is that?
What was that?
If you're single, what is that amount?
It used to be 86,000, but it's higher now, but I'm not positive. You can look it up.
Okay.
It won't be, just look up IRMA, IRMAA, and you'll get the amount for 2026. And again, it's based upon your 2024 tax return for 2026. Now, if you have a change in your life, let's say you made a lot of money in 2024, but now you stop working. You're allowed to call Social Security and say, hey, I have a change in circumstances, I'm no longer making that income, and therefore they should not charge you the IRMA. Okay?
My husband did that, by the way. Charles helped my husband, which I said to some of you, he turned 65 this year and he stopped working. So in 2024, his salary was significant, but now he's no longer working, and he won the dispute. So
Okay.
I
Yeah,
also did that, but
Yeah.
I retired,
yeah, he
and then I had my payout on sick leave, so my income was pretty high.
that's
But
right.
then it went right down. And
That's
I
right,
did
and that's
appeal
what
it.
happens, so.
yeah. So it's worth.
Remember,
Like
this stuff
you
is
okay.
determined by Social Security, not by Medicare. So if you're subject to IRMA and there's a change, then you need to deal with Social Security to remove the IRMA. But most people who are working and have IRMA continue to work and they have that income and they're on IRMA for a number of years.
Is there a penalty if you turn 65 and don't sign up for Medicare? Part
Yes, there is. Thank you for raising that, okay? She asked about a penalty. Yes.
A? Oh,
If I am becoming eligible for Medicare and I don't have any other coverage which is considered comparable, like my job coverage, most job coverages are comparable, so I won't be subject to a penalty once I leave my job and enroll in Medicare, okay? But if I'm eligible for Medicare and I have no other insurance, I have to have A and B, because if I don't when I'm first eligible, they charge me a penalty. And the penalty for Part B is 10% per year for each full year of Medicare. If I have Part D and I don't have drug coverage from another source, then I'm gonna be charged a penalty for my Part D plan, which is 1% a month. For every month you're not on Part D. It's very complicated.
Next question. My husband's 75, still working, well, he's never gonna retire, he has medical from his work. I'm 67, I never signed up for A or B, he signed up for
Yeah,
A.
but you're covered under your spouse.
I am,
So there's
do-
no
so
issue.
should I still be signing up for A?
No, you don't
now?
have, you're, again,
Or-
when he stops working,
Right.
that's when, the rule is, are you an active employee?
My husband now.
Once you're no longer an active employee,
Right.
you have to have Medicare because Medicare becomes primary.
Okay, but should
Okay.
I, at 67, still be signing up for Part A even though?
If you want to, it's gonna be free. Did you
Well,
work
not-
10 years?
Oh, yes.
Okay, then no problem. Or even under your husband, you can get Medicare Part A for free. So I wouldn't worry about that, but you don't have to. It's optional. But since Medicare Part A is free for most people, we encourage people to sign up and get Part A, get their Medicare number, and then when things change, they just have to add Part B and
Makes it
decide whether they want to have a Medicare Advantage plan or stay in original Medicare, buy a Medigap and buy a Part D drug plan.
But if he ever decides to retire at 75, do we have to sign up during this only enrollment period?
No, when you retire, you have a special enrollment period,
Okay.
okay? And I think that's,
7 months.
it's a decent period of time.
3 months.
Yeah, so, you don't have to worry about that. You have, I think the rule is 63 days, so once you retire and lose your coverage and you have a special enrollment period, you just add it. And they'll tell you when you're, let's say, enrolling, they'll say, well, did you have other coverage? And you'll say, yes, we did, and therefore you're not gonna be penalized. And what you should do is you get a letter from the employer saying, yes, this person had medical coverage to us, and you have evidence of that.
Is there a special form that they provide, or is it just
When you say they,
the company is, let's say I'm an employee and I'm past my 65th.
I don't think it's a special form. I've never heard of a special form, but just evidence. I'm sure they can give you a letter saying they have evidence of coverage.
Okay.
Okay? So, and you want to keep that because that's evidence. Because, I hate to say it, sometimes the government doesn't always act properly.
So you said Part A is free? for
If you
most
work,
people,
yeah,
but
Part A
some-
is based on credits.
Okay, so
And you
don't
get
have
4
to-
credits a
okay.
year,
Okay.
unless you're working for free. You get 4 credits a year based upon your earnings, and after 10 years, you have 40 credits, Medicare becomes free. Some people can actually pay for Part A because they haven't earned enough credits to get Part A for free. Okay?
Got it.
So, and look,
And
this
then
is
enrollment
very
can start from-
what was that?
The enrollment can start from 64 and a half, right? When you
Yeah,
start
well,
from 64 and a half.
when you first become eligible for Medicare, it's called the initial enrollment period. That's 3 months before the month you turn 65, the month you turn 65, and 3 months after. I always recommend that you enroll in Medicare the 3 months prior to your birthday, so that it becomes effective the month of your birthday. If you don't do it the month of your birthday or before, no, you wanna do it before, then it's gonna be a delayed a month. And you don't want a gap in coverage. Unless you have some other coverage that's gonna last you a little longer. All right? And remember, COBRA, some people believe that if they leave their jobs and they get COBRA coverage, that's all they need. No. COBRA is not considered comparable coverage. And if you go 18 months when you're eligible for Medicare and you only have COBRA, you're gonna be penalized. So, people, that's another, as you can see how complicated. Why this thing is so complicated for Medicare, I have no idea. Why is there a Part A, a Part B? Why can't you just be one part? Why do you need a separate Part D? And why can't you do that on the one part? But anyway,
What would you do if they had just nothing simple?
and make it easier, that's all. I'm just trying to say, this is complicated.
Very
The
complicated.
questions I get, remember, I do this for a living. And most people don't know what to do when they turn 65. And a lot of people nowadays are still working at 65. So they don't know how working works with Medicare.
Someone had once told me that when you turn 65, you're automatically enrolled in Medicare Part A.
No, that's not true. If you're collecting Social Security when you turn 65, yes, then you're automatically enrolled in Medicare. But if you're not enrolled in Social Security, then you have to apply for Medicare, and that's the initial enrollment period that I mentioned earlier.
Thank
Okay? And every year you have open enrollment.
It's really easy to get your card like almost right away.
Oh, really?
Yeah, because it's
Yeah.
not like Medicaid, it's Medicare, so it's just that captive amount of, that's all they do is, you know, so it's really simple.
Yes.
So what if you spend an extensive amount of time overseas while retired and you're on Medicare or Medicare Advantage, or in the extreme event you
Yeah, you
actually
won't
retire
earn
overseas?
credits for the Medicare Part A. You know, there are people, especially women in our country, who haven't worked during their lives. Well, then they can rely on their spouse's credits to enroll, so that's not an issue. But what if you're an immigrant and you've been here for 5 years and you're legally an immigrant, you're eligible for Medicare. But you didn't work in the United States and have Medicare withholdings. You can buy Part A, but that's expensive. Okay?
That wasn't my question. My
Oh,
question
I'm
is,
sorry.
I have all the credits you want, but I've decided to retire back in my original home country, which happens to be Belgium, for example.
Yeah,
Would
you
I
can
have
keep
to do that?
Medicare while you're overseas. A lot of people do that.
Mhm.
Okay?
And then you just have to submit the bills for any medical care. you
Yeah, but
receive
there's
in
some
the US,
issues
or what?
about coverage when you're overseas, so it's, I don't know all the answers to that, but you have to
Okay.
really check.
Mhm.
Because I know Medicare doesn't cover you when you're traveling outside the United States.
Mhm.
So if you're living outside the United States, you may not be covered. So, but, I mean, you know, when I worked in Europe for a lot of years in France. I had an office in Paris, and I got sick once. And they admitted me to the American hospital in Paris. And they didn't charge me anything, even though I wasn't a French citizen. So the coverage in different countries can vary depending on the country you're in and the rules. So I don't know about Belgium, so you'd have to check on that. But Medicare, if I had to guess, you're not going to be covered. You can get Social Security if you're living abroad, but Medicare won't pay you if you're out of the country.
So I read that Medicare, regular Medicare is now having some pilot programs.
Yes. You guys know too much. It's called WISE-R. Don't ask me what. W-I-S-E and then a small r with it. WISE in capitals. They're experimenting with prior authorization for like 12 procedures in Medicare, which they never had before. But they're worried that some of these procedures are being misused, so they're making it prior authorization, and it's in 6 states.
It's in New Jersey.
Yes, one of the states is New Jersey. But if you look at the list of the procedures that may require prior authorization, New Jersey is part of this pilot program. You're not gonna have to worry. I've never heard of some of them. So it's not gonna be very, very effective to reduce most people's care. I don't think it's gonna be an issue. But they may determine that nationally they want to institute prior authorization for some procedures in original Medicare, which does not exist right now.
What is it called again?
WISE-R, W-I-S-E small r.
They could
I don't know what it stands for. You can look it up.
To get wiser, I guess, but in an original Spanish.
Just a little bit though.
Because it looks good on the logo.
Yeah, but anyway, so, you know, we're here to help. So if you have questions about Medicare, you could always call me. Even though I'm only a ship counselor in Middlesex County, you know, I cheat. and I help people no matter what part of the state they live in, especially friends and relatives. And I get extreme, even my dentist is now coming to my house to ask about Part D changes in enrollment in Medicare, and you'd think he'd offer me a discount, but no.
One more question.
Yeah.
We have an adult son with a disability, and he gets Medicare now, because my husband's over.
Speak louder.
We have an adult son with disability, lives in a group home, and he's on our private our private insurance, because my husband's still working, but he also has Medicare. When we're gone, my husband and myself, will he continue to get that Medicare and he gets Medicaid too?
Yeah, I don't see why he wouldn't. There's no income or asset test for Medicare. There's an income and asset test for Medicaid.
Right,
So I don't know what his situation will be then, but
right.
as long as you can afford to pay your Part B premium and other costs of being in Medicare and a supplement or a Medicare Advantage plan. And by the way, there are Medicare Advantage plans that are basically for people with chronic conditions.
Okay.
Okay, they're called DSNPs, which is disability, so, and their list is here.
Okay.
So you can have Medicare and Medicaid at the same time.
Okay.
You're called a dual eligible,
Okay.
okay? So which is good for some people because, Medicare doesn't cover certain things, but Medicaid will cover your dental, will cover your vision, will cover your hearing. You don't get that in original Medicare unless you're in a Medicare Advantage plan, which offers these additional benefits. And Medicaid pays for things that original Medicare does not cover. But of course, you have to qualify. And with the new administration, we won't talk ill of them, but with this new legislation, they're gonna make it a lot harder for people in Medicaid. They might have to reapply now every 6 months. And they're gonna crack down if you're eligible to work. They're gonna kick you off the Medicaid rolls if you don't work. So there are a lot of changes that are coming. We don't have all the specifics yet, but it could be a significant change, and they expect a lot of people to be kicked off the Medicaid rolls in almost every state. Any other questions?
Are you gonna go into the details of Part D? Which I
Part
think is
D,
like
okay,
horrendous
let's
to
talk
deal
about
with.
Part D, okay. Now, Part D works with original Medicare,
Right.
okay? If I have Part D, that means I'm in original Medicare with the supplement usually. I cannot be in a Medicare Advantage plan. The only people that can have more than the Part D and some other drug coverage are veterans. So a veteran can have veteran drug coverage and also have a Part D drug plan. And I recommend that to veterans all the time because let's say you need a simple antibiotic. Do you really want to go to the Veterans Administration, wait to see a doctor, and then get the medication? No. So I tell veterans, pick the cheapest plan. This way you can get small things and you don't need to go to the Veterans Administration to see a veteran doctor. But Part D basically is a drug plan that works with original Medicare. And every year the plans change. The premiums change, the deductible changes, and the biggest thing that changes is the formulary, the list of drugs that are covered under the plan. So when you compare plans every year like I do, I have to make sure that all my drugs are covered. If all my drugs are covered, fine, then I pick the cheapest premium plan because I really don't care what Part D company covers my drugs. And I want to pick up a pharmacy which is preferred. Remember, in Part D, you can go to any network pharmacy. But if your pharmacy is a preferred pharmacy, then the cost of the drugs, the co-pays, are cheaper than in just a network pharmacy. Okay? So you have to compare Part D drug plans every year. And Part D, really, you can't get drug coverage from original Medicare. You need a separate standalone Part D drug plan that goes with original Medicare.
And tiers.
Oh, well, okay. Now, the
Sorry.
cost, yeah. Now remember, when I'm doing a comparison on the Medicare website, which is called the Medicare Plan Finder, I put all my drugs in, the dosage, how many times a day I take it, and that comparison tool tells me the top 3 plans based upon the annual cost. Okay? So, it includes the premiums, the co-pays, the deductibles. So like I said, I picked the Humana plan that's on here. Okay, you can see the 440 on the bottom in yellow. Okay, so I'm in that plan. But what if I'm in a very expensive drug? Here's what the drug companies do, the Part D drug companies. They put the drugs in certain tiers. And the tiers go from 1 to 5. Okay? Now, tier 1 and 2 usually are generic drugs or low-cost special generic drugs. And in many plans, even though there's a premium and a deductible, they don't charge you the deductible for low-level tiers. Again, it depends on the plan, and all that information is in your chart. Okay? But if your drug is in a tier 3 or tier 4, or it's a specialty drug in tier 5, your co-pays are going to be much higher. But there's a savior. The savior is, under the Affordable Care Act, there's now a cap on the cost of drugs, whether you're in a Medicare Advantage plan or a Part D drug plan. Next year, that cap is $2,100. So if you're going to spend more than $2,100 on drugs, once you hit $2,100, all your drugs are free thereafter. Okay? And believe me, it is a big benefit to some people. I have a friend who would spend $2,100 based upon her condition on drugs in the first month. So after that, and that includes a deductible. After that, all her drugs are free. She can't believe it. And next year it's $2,100, so it's going up $100. You have any other
No, I was
questions?
just thinking quietly that the federal government could reverse that.
Oh, of course. Well, they can do, listen, what I'm saying now is based upon today.
Right.
I don't know what's going to happen tomorrow.
So you have detailed information on Medicare Advantage, on the Part D,
Yeah.
but not on the supplemental insurance.
No, because
here.
you can't, I can't get charts on supplements. I can do searches based upon the zip code and age. Okay? So remember, when you first turn 65, that's going to be the lowest premium. I just put a woman yesterday on a G plan, which is the best plan now, and she's paying at 65 $140 and something, $144, whatever it is, for a supplement. And I told her, listen, you do realize as you age that your supplement's going to keep going up like I am. I'm an old man and I'm paying $359. When I first joined my supplement plan, I think I was paying $165, and now I'm paying $359. So that's a significant increase over the years.
But it doesn't go up based on your health.
No, it doesn't go up.
Condition
It goes up
on your
based
age.
upon your most. As you see, most of those supplement plans are age-attained plans. You know what that means? As you attain an older age, you get charged more, because they know that the older you get, the more health services you're going to need. So as you age, the premium goes up, and you have to just understand that, knowing that if you're in a supplement plan, you're probably going to be in that same plan for life.
But
Because of what I said about once you have chronic conditions and you no longer have guaranteed rights, it's going to be almost impossible to switch supplement plans.
But the Advantage plans don't go up as much as the supplement?
The Advantage plans?
Yeah.
That's hard to say because they change every year. The environment changes, the economic, the cost of health services. What I read was that the overall, these premiums for Medicare Advantage plans was going down somewhat this year compared to last year. So I don't know if that's any indication, but you know, it's very hard for me to answer because they change every year. And you know, these companies don't want to lose money. So that I can tell you. So they're not going to do anything. But you know, like you take this Humana plan, which is $4.40, the Part D drug plan. Here's what happens. People see this plan and they all enroll. So what does the plan do for the following year? They raise the premium, and they know that most people aren't going to compare plans, and now they're stuck with a much higher premium, just like my Cigna plan is going to $59. Well, if I hadn't done a comparison and I waited to January 1st, I'm stuck for the whole year because I didn't switch plans.
Can you tell us about any dental or vision coverage?
Yeah, remember, you're only gonna get those from parts of the Medicare Advantage plan, and every plan is different.
Okay.
You have to look at the details and what the coverage is. Like, they might say, we'll pay $1,000 over the year for a hearing aid. They're not gonna cover the whole hearing aid, you know? So every plan is different, and you have to look at the details of the plan to see what the coverage and those extra benefits cover. But not original Medicare, at least not now.
Original Medicare, you can't get dental and vision.
You can buy private,
Private, but not original.
not original. You won't get coverage from original Medicare. Dental, hearing, vision. Now, it doesn't mean that if I have an eye injury and I fall, I'm not covered, because that's an injury, even though it's with my eye. Okay? But standard, eye vision testing and glasses, absolutely not.
I had cataract surgery, yeah.
Cataract is covered.
Yeah.
Okay? And I know I had cataract surgery in both eyes, but I had to pay because I got the more expensive lens. Remember, you have an option, you can get the standard lens that's covered by Medicare, and when the doctor said, take the expensive lens, I said, okay. What am I gonna say, no? So that's what so it depends on, every individual is different. But technically, cataract surgery for each eye is covered, and after the coverage, you are covered for one pair of glasses. Any other questions?
So, I'm still working now. I will be 65 next month. I'll be covered until January, the end of January 30th. So,
Are you retiring?
I am retired.
Okay.
So what would you recommend in that?
Well, I don't see any reason why, since you're becoming eligible, just join Part A, and then when you leave your job, are you gonna lose your medical coverage?
Yes.
Then you have to add Part B, and then you have to make the decision, do I go a supplement original, or do I go into a Medicare Advantage plan? You have a special enrollment period to do that.
Okay, but it's not something that has to be done today.
No.
It's something I can
Because
wait.
you're still covered.
Right, okay.
So why would you wanna, well, you're only talking 2 months,
Right.
so it's,
But he could enroll in Part A now, because when
yes,
he
you can
turns
enroll in
65
Part A now.
Yeah, but I'm in an
And remember, you're gonna be in your initial enrollment period. When do you turn 65?
November.
November, so you're in your original, you can do everything right now. The original initiation period, enrollment period, gets priority. Okay? So you're gonna be in your initial enrollment period, so you can enroll the 3 months before January. Go ahead and make it effective then on January 1st.
So you tell them when you want it to be?
Yes. Well, Medicare will only become effective the month of your birthday. Okay, so that's November. But Part A is free, you could then add Part B.
Right, but.
Or if you don't want to, a lot of people don't want to bother, they'll just add Part B now and not worry about it. But that's up to you.
But I have an HSA, so that's.
You have a what?
A home, health savings account. So
Oh, okay.
I
Well,
don't
all
know
right,
what-
that'll help you, obviously.
Well, what I mean is, if I sign up for Part A now, they stop contributing to the
Yeah,
HSA.
yeah,
So
well,
I'll wait.
yeah, that just happens to be the rule.
Yeah,
But you could still use the health savings account money.
exactly.
Okay.
Oh, interesting.
Okay, any other questions? Did I confuse most of you?
One clarification, so whether you have Medicare Original or Advantage, you have to enroll in Part A and B,
Correct,
always?
correct.
Okay.
You have to have both A and B to be an original Medicare or a Medicare Advantage plan.
Right, they need to see your card when you go for the Advantage.
Yeah, remember, if you're in a Medicare Advantage plan, you get a separate card from the plan, which is the card you present for all your services, because that's the plan that's covering you. If I'm an original Medicare, then I have my Medicare card, okay? And once I go to a new doctor or the hospital, they look at your card and, you know, they accept it. And then, of course, you'll have your supplement card, which is the secondary to original Medicare, and you'll get a Part D drug card. But, you know, once you go the first time to a doctor and you give them all that information, you know, I tell people don't even bother carrying your Medicare cards. I don't carry my Medicare cards, you know, because I don't need to. Even in an emergency, you know, I'm covered. I don't have to worry. I mean, they don't, if you're in an emergency, do the cops or the ambulance check you to see if you have medical coverage? No, you're covered. You could always give them the information later. So I always advise people, don't carry your Medicare cards with you. If you have a smartphone, take a picture of it, and because people can't get into your smartphone. Or you make a copy of the card, you cut it out, and you cross off some letters and numbers that you would remember. And then you carry that in your wallet or purse, whatever. But don't carry the original Medicare card. You don't have to. Okay?
You mentioned the ambulance, so Medicare Original probably would cover most ambulance type services, whereas the
No,
Advantage
ambulance
has to be a
coverage is
network.
very complicated.
It's horrible.
Ev-
It's horrible.
Okay, if I could walk to the ambulance,
Or crawl.
I'm not covered. I have to only be able to get coverage from a hospital ambulance if they have to actually carry me into the ambulance. Otherwise, the ambulance coverage is, people don't realize that an ambulance coverage can cost thousands of dollars. So have to, if you can look it up, but the ambulance coverage rules are very complicated. But I know of one thing, don't walk to the,
At the end of
don't
my
walk
dad's
to, make
last
sure
year,
they take you in a stretcher.
He had Medicare and good coverage, but he was taken by ambulance a few times, not New Jersey, North Carolina. The ambulance bills were unbelievable, and the hospital was 3 miles from his house. I'm talking like $2,000 to $5,000 bills.
Yeah, they're very expensive,
It's
so that's
crazy.
why I say be careful with ambulance coverage. If you can drive yourself to the hospital, do it. I mean,
Horrible.
I'm sorry
How
to
can
be,
we contact you? Okay.
Carrier pigeon.
plus you have the materials inside, have my telephone numbers on it.
Okay.
The only thing that's not on my material is my name, and my name is Charles Clarkson. And I have business cards if you'd like a business card.
I would like that.
Okay, so thank you all for coming, and
Yeah.
I'm always available to answer any questions. As you can see, I like to speak.